want you to tell us, what are the common allergies in children that you would want addressed? What are the common allergies in children that you would want addressed? Our Twitter handle is at K24TV. We are receiving your tweets right now. The SMS number you can use is 21222. Also tell us where you're watching K24 TV from and what your child is suffering from. Karen Karimi is now talking to a pediatrician. Karen, this is a very big concern with parents, especially new mothers and new fathers.
It is.
Are you going to address that?
Of course. And of course, Dr. Mugo is here. Thank you so much for coming through. He is a pediatrician and a pulmonologist. Thank you so much, Dr. Hari. Let me start by asking, if both my partner and I have allergies, will our children also have allergies?
Yes, there is a great likelihood that if you have allergy and your partner has allergy, because there is what we call a genetic predisposition. If they get exposed to an environment that has allergens, that child is likely to get an allergic reaction.
Yes. So how do I know if it's an allergy or a cold?
That's a good question. Now, the cold usually is predisposed by a change of weather. You have something like the rain, the drizzling, or change of temperature, and then you see some children starting to sneeze or to cough. That would be a cold that is caused by organisms called viruses. But the allergy, whether it is cold or not, you could get an allergy in several sites of the body.
So what are the most common types of allergies?
The most common types of allergies are, one, you can get the allergies of the eyes, where you get the redness of the eyes or you get the itchiness of the eyes. You can get the nasal congestion or the itchiness of the nose. The word we use in that allergy is called rhinitis. Or you could get the allergy around the throat area where the glands swell, which are called tonsil or tonsillitis. And it could get worse and get down to the chest. And when it gets to the chest, you get the narrowing of the airways, which we call bronchospasm, and could end up with a situation that we call childhood asthma. But you could also get allergy around the skin, where there is itchiness, change of color on the skin. So those are the main areas. So in summary, the eyes, the nose, the throat, the chest, and the skin.
What about the worst form of allergy?
The worst form of allergy, especially which disturbs many children and sometimes takes them out of school, would be that allergy that comes to the chest, usually manifested by the tightness of the airways. And I have a model here that can help us to understand about that. The airway should be open like this, but when you get that allergy, it gets
Here you go, you can use my pen. Yeah.
It gets a bit tight like that, so you don't get the air in, and the objective is to open up to that area. So that's called bronchospasm or tightness of the airway. And of course, there can be a very severe situation like this one, that no air is entering into the airway. So the objective is to maintain the airway. So this is a very severe situation, but good news, can be managed by use of some medication. And we do have currently medicines that are called inhalers, and they're in two groups. One of them is called a reliever, which is usually given as a puff. And depending on the age and the severity of the tightness, this puff can be given like 1 puff or 2 puffs 3 times a day. We call it 8 hourly. And if you use it for about a week, you can get a good relief from that tightness to there. But after you're finished with that, you will be continuing with what we call a reliever, and a controller. Pardon me, because many parents make that mistake. They are called controllers. And there are several types depending on the companies, but we call them anti-inflammatory products. And these ones are used morning and evening. Usually the first cycle is for a period of 42 days or 6 weeks. And usually we prefer the doctor to be the one that will step down. So if the parent used the reliever and then the controller, we can get out of that severe allergy and prevent one from getting to that area, and that's what we normally would call the childhood asthma. Now, when a child comes to us when they are taking the medication, some children will not be able to take the puff directly. So we have a tool here we call an inhaler chamber. And this inhaler chamber, you'll just connect your gadget on that area like that. And then you do the puff. And when you do the puff, the child will breathe in like this, and it has a valve. And within a count of 1 to 10, the medicine here is over. So if you're told to give 2 puffs, you shake, you give the first puff, and then about 10 seconds, and then you do the second shake. If there are 2 puffs, that's enough. And opens the airway, and the child gets relieved. The child can start playing.
At what ages can a child use that?
Even up to 3 months.
Okay.
Yeah, we can use this medication because they are called dilators, bronchodilators. Okay. They open up the airway. When they're also very tight, we have another very important gadget called a peak flow meter, which can help the doctor to find out how tight is this chest. Because once I use my stethoscope and I hear some sounds, they'll tell me the chest is tight. But this gadget, which we recommend in each and every clinic and each and every hospital, is a very important gadget that a child will come in and just puff like that. And when this piece of metal moves from that to there, I'll say that these are the liters per minute.
Okay.
Now, and then there's a chart that helps me to know this age and this height will be either 150 or 300. So if the child's normal was 300 and they puff and it comes to 150, I'll know that child is tight. But luckily, after using the reliever, it opens up and you can see an increase in that up to the 300.
Fantastic, Dr. Ari. I want us to talk about anaphylaxis. I hear it's a very deadly allergy. What is it, very quickly?
Wonderful, Karemi. The anaphylaxis is a very, very severe type of allergy. And this could be contributed by something like a bee sting or a wasp sting or a type of a medicine, especially products that are called salva drugs. And if you ingest that product, like a salva drug, there are some people who react so badly to where the skin can even start peeling, their eyes are swollen, their blood pressure can go down, and it can actually cause a terminal situation.
Of course, death.
Which
is very, very, very sad. Let's go to the food allergies now. For example, if I'm pregnant, yes, and I'm allergic to maybe, say, eggs or seafood, does that mean that my child, the likelihood of them getting the same allergy is high?
I would mention that, yes, if a mother is allergic to a certain product, even when you're doing breastfeeding, there is a great likelihood that your baby could also get that allergy. Like there are mothers who are allergic to cow's milk. And when they take the cow's milk, in whichever form, some of their children could start manifesting what we call the cow's milk allergy. And
very quickly, Dr. Ari, I just want to ask you two very, very quick questions because my directors told me at time I don't have enough time. Do children outgrow food allergies?
Allergies, not only food allergy, but even the other allergies, when they are well managed and the environment is well managed, yes, a number of children outgrow. Even this so-called severe one, at an age of 1 to 2 to 3, some of them start outgrowing some of those severe allergies.
What about pet allergies? Because I know so many families who love their kids around pets, especially cats. So how can they manage that well?
Yes, pet allergy is also a very noted issue in medicine, usually the cats and the dogs. You see so many people walking with their dogs, but some of the mites that are in the fur of the cat or the dog, they can cause allergy.
Okay, thank you so much, Dr. Ari, for that insight and for coming tonight. If you have any questions, of course, for Dr. Mugo, do tweet us at K24 TV. Eric Njoka will be back with the business news.